Who are you? What's your, really what's your superpower, and why should you win this award?
I'm Rob, the president at HeartBeam. What we've developed is this, an easy to use credit card size 12 lead EKG that's completely cable free. And so the problem is that a 12 lead EKG is needed for heart attack detection and detecting complex arrhythmias, but that requires multiple external electrodes. It's really not suitable for a patient to use or apply at home. And then most of the wearables and at-home ECGs you're aware of are reduced leads, generally one lead, so they really aren't appropriate for detecting heart attacks and complex arrhythmias. So what we do is we collect the heart's electrical signals in 3 orthogonal axes and then synthesize a 12-lead ECG. So our superpower really is allowing patients to have a 12-lead ECG with them at all times, fits in the wallet, and really going after a number of things. First of all, detection of complex arrhythmias and heart attacks, where the average patient at home delays 3 to 4 hours before seeking care. Mortality rates are 40% higher, but longer term can go after monitoring for chronic conditions and even screening as well.
Specific examples of how it's being used by, again, any partners, any hospital systems, anyone who you can talk, give us something specific about how it's impacting care.
So we are pre-commercial. We're in what we hope is the very final stages of our first 510(k) clearance. So let me just really quickly give you a piece of data and an anecdote. So the data we've published in JACC Advances last year, where we looked at the performance of our device versus a standard 12-lead ECG in detecting coronary occlusions. And top line was we matched performance, which was great. But what was fascinating is that we onboard our patients so we have an asymptomatic baseline. And we found with either a 12 lead or ours, that actually increases performance 30 to 40%. So what we found is if you go to an emergency room, if you're not a known patient, you have one ECG, we could potentially be 30 to 40% higher. But the anecdote I want to give is one of our engineers in Europe developing the system, and they have devices as we're fine-tuning the performance. He lives in a remote area, actually had chest pain symptoms, said, I guess I'm going to try doing this myself. He put it on. It was the classic telltale signs of a heart attack. He was able to go to the emergency room, get care, and got treatment so early that there was no heart damage. So it's great for him, great for the company, but it kind of a good sense of what the potential is for our technology.